listener production.
Hi, Sacha Barbour Gatt here. Welcome to The Briefing. A World Health Organization study has found that over the last 50 years, 6 lives have been saved every single minute thanks to vaccines. May, the month of May, marks 50 years since the creation of the expanded program of vaccination, which was launched in 1974 with the aim of vaccinating against tuberculosis, diphtheria, tetanus, pertussis, polio and measles. Over time, the program has come to include other vaccinations, including the one for COVID. Thanks to the rollout, smallpox was declared eradicated in 1980 and polio has been reduced by over 99% globally. But stories of side effects of different vaccines persist, most recently with AstraZeneca withdrawing its COVID-19 vaccine due to a rare blood clot. So, just how common are the severe reactions to vaccines? And does the good they do outweigh the possible damaging side effects? Professor Margie Danchin is a paediatrician at the Royal Children's Hospital. She's also group leader of the Vaccine Uptake Group at the Murdoch Children's Research Institute. Hi, Professor. How can we measure the impact 50 years of the expanded program of vaccinations has had, given that we don't have anything to measure it against?
Yeah, thanks so much for having me. Well, as you just said, the Essential Program on Immunisation is celebrating its 50th birthday, which is incredible. And we can actually measure the impact of the program. And the way we do that is by looking at the number of lives saved. And the World Health Organization has actually released, in celebration of this milestone, some really detailed modelling that actually shows the impact. So when the EPI, as it's called, was introduced, it was in 1974, and it was originally just against 7 vaccine-preventable diseases, and it's now in excess of 14. And what they actually have been able to show is that over 154 million lives have been saved from the EPI program. And as you would anticipate, this is mainly for children under the age of 5 years. 2/3 of those lives are in children under 1. Their really big headline finding was that now children under the age of 10 have a 40% greater chance of living to their next birthday than they did 50 years ago. So it's an extraordinary impact. And in fact, you could say that the routine immunisation program globally is probably one of the greatest public health success stories of our lifetime.
Vaccines, we know what the benefits are, but there are documented side effects that come along with vaccines. I'm curious to know what the feeling of that is in the medical community, as in, is there an acceptable percentage of side effects versus reward when it comes to vaccines?
So the most important thing to note about vaccines is, like any other medication, they have side effects. And in the most part, they are treated very simply by Panadol or Nurofen, and you might need a day off work, or a child might need a day at home, but you recover well. Unfortunately, there are also some rare and more serious adverse events or side effects that are associated with vaccines. And again, it's really important that health professionals and public health professionals are very transparent about the risks of these side effects, so that people can weigh up the risk of a vaccine and the benefit of a vaccine. The ledger, in my opinion, definitely falls on the benefit of vaccines compared to the risks. But for example, when you ask about sort of severe or more serious side effects, so for example, to the whooping cough vaccine that infants are given at 6 weeks, 4 months, 6 months, there's a very, very rare adverse event called a HHE, or hypo-responsive episode, HHE. And that occurs in about 1 in 30,000 infants, where a baby might become pale or floppy and less responsive for a short period of time. Lots of research has been done. We know that it doesn't have any long-term effect on the infant, but it's very scary for the parent. And those sorts of adverse events, in every state in Australia, we have a specialist immunisation clinic where if a child or an adult experiences rare side effects from vaccines, they can be seen by an immunisation specialist, have a consultation, talk through what happened, and have counselling regarding future vaccination. So vaccine safety is taken very, very seriously in Australia and, many countries around the world in terms of surveillance for those common and expected side effects and also for those more rare side effects.
COVID was an interesting time for a lot of different reasons, and I think one would be the, resurgence, or it felt like it was more pervasive, the anti-vax movement. And COVID wasn't the first time that vaccines have had any PR troubles. There was unverified claims decades ago that vaccines could give you autism. There were also, I noticed, vaccine injury stories seem to kind of pop in and out. I remember when I was a teenager getting my vaccine against cervical cancer. There were a lot of vaccine injury stories going around at that time because kids were going into schools to get a new vaccine. So there was this hesitancy. My question to you around all of that is, why is there such a mistrust of vaccines in certain circles, and why do they continuously share this information? Do you think there's any basis in reality for those people and what their beliefs are?
Well, as I said, vaccines do have side effects, and unfortunately we do see rare and serious adverse events. But in the most part, before COVID, I would say the anti-vax movement was fueled by the fact that vaccines are a victim of their own success. We don't see a lot of these diseases anymore because in the most part, high-income countries have high immunisation coverage. We don't see diphtheria, tetanus, polio. Yes, there are some like whooping cough and the meningococcal diseases we do see, but a lot of them are still very rare. So I think, unfortunately, many parents today don't have experience with diseases, like measles that our parents did. And so, of course, the vaccine or any side effects associated with the vaccine loom larger. And there are pockets, as we know, online, social media, that really do propagate these stories that are mostly untrue around vaccines. As you said, the Andrew Wakefield myth that vaccines, particularly the measles, mumps, rubella vaccine, causes autism has been widely debunked. It's now over 25 years since that was published in 1998. We know that publication was withdrawn from the Lancet 10 years later, and that Andrew Wakefield lost his medical registration. He's unable to practice. But unfortunately, these allegations stick. Misinformation is very sticky. And yes, as you said, this did become more pervasive through the COVID rollouts. And that's because I don't think vaccines have ever been more closely scrutinised in history. I mean, who would know all the names of the different flu vaccine brands? Everybody knew every COVID vaccine brand, every adverse event associated with the COVID vaccine brands. And I don't think that's a bad thing, but everyone suddenly became a vaccine expert and an epidemiologist. So I think we've just got to stick to the facts.
Well, let's stick with the COVID vaccine chat for just another minute. AstraZeneca recently withdrew its COVID-19 vaccination. Now, the headlines said it was because of a rare blood clotting disorder that had been picked up from people who had had the AstraZeneca vaccine. So is this the slam dunk that anti-vaxxers had been waiting for then?
It was called TTS, thrombosis with thrombocytopenia syndrome, that was associated with the AstraZeneca vaccine. And that platform, which was called an adenovirus vector vaccine, it was associated with that platform of vaccines. We knew about that through the COVID rollout. It was well documented. The surveillance for adverse events picked this up in Australia and globally. It's very rare. It occurs probably somewhere between 2 to 4 per 100,000. AstraZeneca have withdrawn that vaccine now mainly because there are different circulating strains, COVID strains now in the community, and that vaccine, which has the original kind of Wuhan strain, it just would not be effective anymore. But at the time that it was introduced globally, it saved millions of lives. It was a cheap vaccine. It was produced very easily. It was developed quickly, just like all of the other vaccines. So I think people need to take it more as a positive that there is such scrutiny around vaccine safety, that governments and vaccine companies do report these adverse events, but that we always need to remember what the COVID virus itself, what the disease and the illness did to people, particularly older individuals and those at higher risk, and balance that against a very rare adverse event. So I absolutely acknowledge that occurred. It wasn't only the adverse event why the vaccine was withdrawn. It was more the effectiveness now in the current climate.
Professor, before we let you go, you can't deny that COVID had an impact on vaccine hesitancy. People were scared about an immunisation they felt had been, quote unquote, rushed through. There were concerns about pressure from governments to get jabbed and what that might mean. Do you think the COVID vaccine program has had an irreversible effect on vaccine hesitancy, and will we continue to see this attitude into the future, or do you think it's time and space and people will kind of go, you know what, thank God that we had the COVID vaccine, so many more people could have died?
Yeah, I think that's a really good point. Firstly, what I would say is prior to COVID, it took about 15 to 17 years to develop a new vaccine. And with the urgency of the COVID pandemic, this was reduced to sort of 9 to 12 months. But I don't think that we did a very good job communicating to the public that there were no steps that were actually missed in the vaccine development process. We still had the same phases, but there was a massive global investment and collaboration that really enabled this to be done a lot more quickly, but it was not at the expense of vaccine safety. There is no doubt that the COVID vaccine rollouts have had an impact on routine vaccination. We have seen coverage reduced for children and adults in Australia as well as globally. I don't think that's all around trust in vaccines. I think part of it is an impact on confidence, but there are many other reasons why vaccines don't get into arms, and there's lots of practical barriers, supply issues, and I think what we need to do now is really have a better way of monitoring what the barriers are in different settings and then being able to respond in a timely way to both those access and acceptance barriers. So I think we're at an exciting time. I think we've got a lot of work to do. And I think we as healthcare professionals need to just get better at communicating that risk and benefit of vaccines to people, inviting questions, inviting discussion and conversation, and really continuing to build confidence in vaccines.
Professor Margie Danchin, thanks so much for your time. We appreciate your insights and I guess happy 50 years of vaccine programs. Is that a fair birthday to celebrate?
Yeah, it's a massive celebration. Thanks so much for having me.
That was Professor Margie Danchin, Group Leader of the Vaccine Uptake Group at the Murdoch Children's Research Institute. And that is all for today's briefing. Thanks so much for listening. Before you go, we would love it if you could share this app with someone you think might enjoy it. And if you want to keep up with our other content, you can check us out on Instagram at The Briefing Podcast. We are also on TikTok and on YouTube. Search Listener Newsroom. I'm Sacha Barbour Gatt. See you next time.
Listener.